Well, it's time now for our Africa Health Network update, and health reporter Linord Moudou is here to tell us about new findings on treating tuberculosis and vaccine-preventable diseases. Right, Linord?
Hi. Yes, Dimiake. Hello, and hello, everyone. A new study suggests TB treatment could be significantly enhanced with the addition of vitamin D to the regimen. Researchers at Queen Mary University in London studied 95 tuberculosis patients. Some received the standard antibiotic treatment, and others were given a supplement of a very high dose of vitamin D, about 10 times the average dose. Investigators found that the TB bacterium cleared from those in the vitamin D group approximately 2 weeks sooner than those on antibiotics alone. Researchers say vitamin D appears to bolster the body's natural defenses. They also say a second effect is that vitamin D accelerates healing of cavities caused by the TB bug. An early test of a dengue vaccine is showing promising results. The mosquito-borne disease infects up to 100 million people worldwide every year, mostly in Africa, Asia, and Latin America, while researchers from France tested the dengue vaccine in over 3,600 children aged 4 to 11. While there was no overall difference between the number of dengue cases recorded following vaccination, secondary tests showed that the vaccine was effective against 3 of the 4 dengue viruses. And the study was published recently online by the journal Lancet. Experts say each year a child dies every 20 seconds worldwide from a vaccine-preventable disease. Here in the United States, a campaign is underway to enable children who need life-saving vaccines have access to them. The Shot at Life campaign is headed by the United Nations Foundation. And joining us in the studio to tell us more about A Shot at Life is Devi Ramachandran Thomas, the director of the Shot at Life campaign. Ms. Thomas, welcome to the show.
Thank you very much. Thanks for having me.
Well, the campaign started in April, and it is really a call for action for people to help children get vaccinated globally. Why was it important to start such campaign? You can tell us about that, but first of all, maybe tell us about the goals, really.
Sure. Well, 1.5 million children die of vaccine-preventable deaths in developing countries, and there wasn't a lot of awareness about that in this country. And I think as mothers, I'm a mother myself, we take our children to get these vaccines, and we know that these diseases have virtually disappeared from this country, and yet we don't realize that they are very much killing children in other parts of the world.
Now, are there some specific type of vaccine or diseases that are being focused on with this campaign?
Sure. In our initial years, we really wanted to focus a little bit on vaccines we thought that were very important and also support the work of the UN agencies on the ground. So what we have done is focused on polio, which we know is in the end game talks right now, and measles, which is a highly infectious disease. We also have been able to help the Gavi Alliance, one of our partners, in the rollout of new vaccines against diarrheal disease and pneumonia. Now, these are some of the leading killers of children. So those are the 4 vaccines we're supporting.
Okay. Now, tell us again, in the long run, what are some of the goals in the long term?
Sure. Our goal is really to increase access to vaccines for children in developing countries. And sometimes these are children who are in the hardest to reach parts of the world, in sub-Saharan Africa or in Asia. And our real goal is to reduce those 1.5 million preventable deaths. But another goal that I think is equally as important is to build a movement here in the U.S. of Americans, especially American mothers, who champion vaccines as one of the most cost-effective health interventions in developing countries.
And how is this campaign being implemented here in the United States?
We just have a plethora of ways that Americans can get involved. And one of the biggest ways that we've been doing that is by asking people to advocate for childhood vaccines, to write to their members of Congress, to host events in their home to spread awareness. We've also been able to ask people to give just $20, which can immunize a child for a lifetime against these 4 diseases.
And can you tell us how this money is being disbursed? When they give $20, for example, what trickles down to the vaccine in terms of the amount?
Absolutely. So the vaccines are actually fairly cost effective. For example, we know that the measles vaccine, it costs $2 to immunize a child for a lifetime. So we've been able to take the cost of each vaccine plus the delivery cost and come up with this round $20 number. And what we're able to do then is to deliver the vaccines through UN agencies such as UNICEF and WHO.
What has been accomplished so far? What have you seen in, 6 months or even less?
It's been very short, but it feels like a lifetime in some ways because Shot at Life has over 150,000 supporters and our reach is almost over 1 million, many of them American mothers. We've seen a huge amount of support from mothers who blog, who have been strong supporters of these global health issues. And we've also noticed that we've been able to raise some funds, and we know that we've been able to deliver over 15,000 vaccines.
Now you talk about the mothers who blog. What are some of the subjects that they discuss?
A lot of the time mothers talk about the fact that mothers in developing countries are not that different from themselves, and neither are the children. Sometimes the discussion topics are sad. For example, we know that sometimes mothers in developing countries walk 15 miles to get to these vaccines. It's a question of access, and a lot of the times that appeals to American mothers. This question of global motherhood is very important to all of us.
And finally, if there was a message that you will want people to keep from this campaign, what will it be?
I think it's the message that every 20 seconds a child is dying of a preventable death. Let's just think about that word for a second, a preventable death. Let's stop the clock.
Let's stop the clock. Thank you so much, Ms. Thomas.
Thank you.
Great. And thanks to Devi Ramachandran Thomas. She's the director of the Shot at Life campaign. And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.